Thanks to all of our witnesses for being here today. And this is a really important topic, and I do hope that we can get this government shutdown over and open back up so we can have follow-on conversations regarding this topic. I visit with Iowa farmers every year, what I call my Iowa River to River tour. And I hear way too often about the crushing weight of healthcare costs on farm families. And it's really disheartening to me to hear that, but it's not at all surprising. The Unaffordable Care Act's one-size-fits-none model ignored the realities of self-employment, seasonal cash flow, and the absence of large corporate employers across our farm country. So our spouses, when it comes to farm families, oftentimes they're serving as the family farm's bookkeeper, maybe a mechanic, they're a veterinarian, they're helping with all of the farm activities, all rolled into one. Many of them have been forced into taking off-farm jobs, not for passion, and I love that people are able to pursue their passions, but, in farm country, we do what we need to do to make sure ends meet. And so we have a number of those spouses that have gone to get employment where they have employer-sponsored coverage. That means 40 to 60 hours a week away from the very enterprise they're trying to preserve for the next generation. And this isn't a one-off anecdote. It's reality for far too many Americans, including my own family. I'm in a farm family. My brother is a type 1 diabetic. He had to leave the family farm operation to take employer-sponsored healthcare coverage with his employer. My sister is a type 1 diabetic. She and her husband do our family farming, but she also works a full-time job off the farm to get employer-covered healthcare. Okay, so we do have to make very tough choices. But unfortunately, Obamacare is unaffordable. And because of this horrible system that is out there, some families are not able to choose to do what they want to do, and they've been driven into other opportunities. But Democrats in Congress have branded Obamacare as a chance to bend the cost curve downward, and that's not true. As it turns out, the only thing it's bending is the bottom lines of every farmer, whether they're in Sioux Center or over to Keokuk in Iowa. And the numbers don't lie. Farmers and their families are subsidizing a broken system that doesn't serve them. Rural America needs solutions that don't force spouses to find off-farm work or forego health insurance altogether. Premiums for both plans on and off the exchanges are going up for individuals and small groups, in large part due to the Unaffordable Care Act's many mandates. This is particularly challenging for self-employed folks and small businesses. So, Mr. Blaze, if the ACA was supposed to expand choice and lower costs, why are so many counties in Iowa down to just one insurer on the exchange? And why are premiums still unaffordable, even with taxpayer-funded subsidies?
Well, Senator, thank you for that question. And some states like Iowa have taken steps to address problems with Obamacare by opening up like Farm Bureau plans and enabling more people to purchase that coverage that's not subject to Obamacare rules. But the answer to your question is that Obamacare failed. It reduced choices and options for individuals.
Exactly. One insurer. One on most of our exchanges. Mr. White, do you think that having coverage for many farmers in Iowa means that they have access to care?
No, I think getting an insurance card in your wallet doesn't mean that you have access to a doctor or a drug on the plan's formulary. What we're seeing increasingly is these plans are HMOs or exclusive provider organizations, 80% of them on the exchanges. That means if you try and go out of network or get something off formulary, the plan pays $0. That's not access to care. We're paying, like, the premiums now are so high, the deductibles are so high, that families are struggling just to meet those obligations, but then they're being massively constrained to the point where they're finding difficulties just going to a doctor or finding a doctor in their area to help them. This is not good coverage. This is really inferior coverage compared to what we see in Farm Bureau plans, in small businesses, and large businesses.
Right, and as the chair had stated earlier, so many of those plans, the high-risk pools, they were all outlawed by Obamacare. I'm also concerned about Iowans being signed up for policies without their knowledge. This is a really big deal. It should be a big deal for every single American that is paying taxes out there. Mr. Blaze, I believe you spoke to that. $0 premium plans have enabled those scammers to take advantage. And look no further than enrollment for individual plans in Iowa doubling or quadrupling, depending on the plan type, since 2019. So, Mr. Blaze, 9 out of 10 healthcare dollars flow through third-party payers. Do you think this has a role in the levels of fraud and waste that we see in Obamacare today?
Yes, Senator, thank you for that question. The Biden-era COVID expansion of the subsidies led to massive increase in fraud in the program. The availability of fully subsidized plans allowed bad actors, brokers, agents to advertise things like free gift cards, cash, to get people's information to sign them up for plans. Bloomberg did a report on this. They quoted a customer service agent who said half of the people that they were signing up had no idea that they were enrolling in coverage. And the big winners are the health insurance companies. So they're getting monthly checks on behalf of all these enrollees that have no idea that they're signed up for coverage.
Right, thank you. And I do think this is a real issue, and I do hope we can reopen the federal government. I hope Democrats come along with us and vote yes to open the federal government so that we can have further discussions. But I must say to all of my Democratic colleagues, we need to have a robust discussion about what is wrong with Obamacare. If we truly want to find accessible ways to provide health care to individuals, affordable choices, then we need to identify all of the failures within this system. So then maybe more people can pursue their dreams. But when it comes down to personal responsibility, you know, my family members have had to make that hard choice to seek employer coverage. It is a personal choice to take care of their own families. And I think personal choices then shouldn't be the obligation of the federal government to find ways to fund access to health care. We all need to figure this out. But again, I really appreciate the opportunity to have this hearing today. And I hope that, again, we can open the federal government and have real discussions about these very real problems for Americans as they're trying to access health care.
Senator Hassel.